Welcome to the fifth video in a series looking at the spread of COVID-19 around the world's regions. This view presents details of COVID-19 cases reported in the last 7 days by countries, areas or territories. Within China, currently, there are 82,875 confirmed cases across China, which is an increase of 818 cases of COVID-19. There are 3,335 deaths attributed to COVID-19. That's an increase of 36 over last week's total. China continues to gradually relax the quarantine regulations within the country, and life appears gradually returning to normal. China has launched a PR exercise surrounding its role in the COVID-19 outbreak in an attempt to distance responsibility and muddy the waters, feeding alternative theories on the cause of the outbreak from the US military to it actually started in Italy. Everyone should be focused on stopping, delaying the spread of the virus by measures imposed by local governments and health authorities. There will be time following the outbreak to investigate the source of the outbreak by the international justice organisations, a step of preventing reoccurrence. This view looks at the Western Pacific region. Currently, there are 27,877 confirmed cases across the region, an increase of 8,645 from last week, with 485 deaths attributed to COVID-19, an increase of 194 from last week. The following countries in the region were largely responsible for the increase in numbers: South Korea over 500, Australia over 1,500, Malaysia over 1,000, Japan over 1,200, Philippines over 1,300. All countries have restrictions in place to minimise the spread of the COVID-19 virus. These next views look at the impact of the virus in Europe. Currently, there are 638,919 confirmed cases across the region, an increase of 317,615 from last week. There are 46,118 deaths attributed to COVID-19, an increase of 27,381 over last week. Spain has recently overtaken Italy as the European country with the highest number of COVID-19 cases, but Italy, Germany, France are not that far behind. The numbers in recent days within the United Kingdom are like both Italy and Spain, and its health system is under enormous pressure. There are a few European countries, Sweden and Holland, who have gone down a different route to managing this outbreak, with less restrictive rules surrounding closures of businesses, cinemas, etc. It will be interesting to monitor the numbers coming from these countries over the next few weeks. This view looks at the Southeast Asian region. Currently, there are 7,815 confirmed cases. That's an increase of 1,644 from last week. There are 289 deaths attributed to COVID-19. That's an increase of 178 from last week. The Southeastern Asian countries continue to be on a slow burn. India and Indonesia are the countries that have contributed the most COVID-19 cases in the last week. It's highly likely that in both these countries over the next 7 days, we'll see a significant increase in numbers and a significant increase in mortality. This view looks at Eastern Mediterranean region. Currently, there are 65,903 confirmed cases across the region. That's an increase of 26,875 since last week. There has been 3,592 deaths attributed to COVID-19. That's an increase of 1,083 from last week. Within the region, Iran has the most numbers and deaths attributed to COVID-19, but there is evidence of sustained community transfer within the borders of other Eastern Mediterranean countries. There are evidence that Iran and their health system has all but collapsed, and data provided may not be an accurate picture of the true impact on the ground. This view looks at the Americas, excluding United States. Currently, there are 52,545 confirmed cases across the region, an increase of 37,459 since last week, with 1,176 deaths attributed to COVID-19, an increase of 934 since last week. The main contributors over last week's total was Canada, almost 7,000 cases, and Brazil with almost 5,000 cases. South America countries remain a concern inside and outside main population centres. Most of the South American countries do not have sophisticated, robust healthcare systems and/or critical care infrastructure to manage the outbreak, and for care of the community is almost non-existent. We expect to see rapid growth across this region. This view looks at United States. Currently, there are 311,301 cases of COVID-19, a staggering increase of 187,084 cases since last week. There are 8,476 deaths attributed to COVID-19. That's an increase of 6,286 from last week. There is no doubt the United States is now the new epicenter of this outbreak, and the situation continues to deteriorate daily. New York City and state still account for most cases and deaths, but other cities and states are not that far behind. Testing for COVID-19 has increased dramatically over the last week. The prognosis does not look promising, and it's difficult to see how the various levels of governments, which in general are dysfunctional on a good day, will unite the population to follow guidance on social and physical distancing. This view looks at Africa. Currently, there are 5,446 confirmed cases across the region, an increase of 1,224 from last week. There are 170 deaths attributed to COVID-19, an increase of 127 from last week. Almost all African countries are now reporting cases of COVID-19. The World Health Organization singled Africa out this week as a region of concern and urging African countries to increase their preparedness for the onslaught that will surely follow. African region does not have the sophisticated health systems seen in other regions and are likely to see a higher than normal mortality rate across all demographics than in other well-developed countries. These next views gives an insight to the major economies of the world. It is frequently said among economists that when America sneezes, the world catches a cold. Well, the whole world has caught a virus, and the number one economy has caught a very severe form of the virus. It's not just America, though it's all the major economies of the world. It truly is concerning the amount of cash that has been spent to ensure the industry, business and individuals are in the best possible position to emerge from this crisis. We are currently in the delay stage and sustaining the measures put in place to mitigate the risk, but we shortly will enter the recovery stage. Time is critical. Emerge too early and risk a secondary wave of infections. Emerge too late and risk more economic harm. This view looks at the major economies of the world, and I've also added in Sweden as a country who's doing something different to the rest of just for comparison purposes. This view looks at the whole populations, numbers of COVID-19 cases within the populations, and expresses a percentage. It also looks at the number of cases that have recovered in each country and also expresses a percentage. It also looks at the death numbers of COVID-19 in each country and also expresses a percentage. Finally, it looks at the mortality rate within each country against the total populations. I'm not going to do an in-depth analysis of the data contained within this view, as everyone will have a different interpretation of the data and the underlying message you see. These next views look at leadership in crisis. At times of crisis, it's not unusual for the world to turn to the United States President for leadership. Across the world, individuals turn towards their national leaders, the governments, to provide the reassurance that they are in control, they have a plan, they have a team who are experts providing guidance, and that individuals are the priority. National leaders, in turn, look towards the United States President. Fortunately, the national leaders within Western society have not followed this president, but based their plans and decisions on subject matter experts' advice and continually stand alongside those experts when delivering their daily status report. It's hardly surprising that the United States finds itself in its current predicament. One of the first actions conducted by this president was to disband the very organisation that planned for and prepared for a pandemic. This is an election year in the United States, and this president played to his core supporters as a hoax, blaming it on the Democrats, recommending individuals to commence taking an unproven anti-malarial medication which subsequently caused significant illness on those unwise enough to take it. The United States is now recommending its population to wear masks when they venture outside their homes. The President, in his latest media broadcast, advised his citizens to wear the masks, but added that he wouldn't be wearing a mask. When challenged by the media, he doesn't want to sit behind the resolution desk meeting presidents, dictators, kings and queens. What we want to know is, when are these presidents, dictators, kings and queens due to visit? These next views discuss what you can do to stop the spread. Experts across the world all agree that the most important fact in preventing the spread of this disease is social and physical distancing. We all have a responsibility to comply with local guidance on social and physical distancing. By complying, With local guidance, we will flatten the curve and reduce the amount of infections in the community. We will protect our frontline healthcare providers, protect the integrity of our healthcare systems. If we don't comply, the failure will be community transfer of the virus, which increases exponentially. Our healthcare systems will become overwhelmed. Our healthcare system collapses. Our frontline healthcare providers are infected and die. Difficult decisions are implemented on who accesses available resources. The choices is yours to make. It is normal to feel sad, stressed, confused, scared, or angry during a crisis. Talking to people you trust can help. Contact your friends and family. If you must stay at home, maintain a healthy lifestyle, including a proper diet, sleep, exercise, and social contacts with loved ones at home and by email and phone with other families and friends. Don't use smoking, alcohol, or other drugs to deal with your emotions. If you feel overwhelmed, talk to a health worker or a counsellor. Have a plan where to go to and how to seek help for physical and mental health needs if required. Get the facts. Gather information that will help you accurately determine your risk so that you can take responsible precautions. Find a credible source you can trust, such as the World Health Organization website or a local state public health agency. Limit worry and agitation by lessening the time you and your family spend watching or listening to media coverage that you perceive as upsetting. Draw on skills that you have used in the past that have helped you to manage previous life's adversities and use those skills to help you manage your emotions during the challenging time of this outbreak. There is considerable amount of misinformation surrounding COVID-19. It is important that you get accurate, reliable information. I recommend the sites listed below. Finally, remember to socially check in with your friends and family. Use any of the smart apps on your phone. Do not assume everything is fine because you haven't heard from them. Do welfare checks on your work colleagues. That's good leadership. The elderly are not as skilled with modern technology than you. Conference calling can be set up, but be patient and innovative in your problem solving. Do not book a cruise on a flown incubator. Feel free to drop me a note via email, YouTube, LinkedIn or Facebook. The email address is below.